Welcome to the Deep Dive. Today, we're tackling something really frustrating. Insomnia. You know that feeling, staring at the ceiling at 2 a.m., just wondering, why can't I sleep? Maybe that's you, or maybe it's someone you know. Well, this Deep Dive is all about unpacking that. We're looking at what sleep research from the last 10 years, 2015 to 2025, tells us about why it happens, and crucially, how science says we can actually fix it. We're aiming to give you that decoder ring for better sleep.
And it's a really common problem. You know, the research is pretty consistent. We see about 30, maybe 40% of adults saying they have insomnia symptoms sometimes. But the chronic stuff, the kind that sticks around, that affects maybe 10 to 12%. And we define that as having trouble sleeping at least 3 nights a week for 3 months or more. So yeah, it's a significant chunk of people dealing with this regularly.
Wow, 10, 12% chronic.
God.
That's huge. So, okay, let's back up a bit. When someone says, I have insomnia, what does that actually mean, clinically? It feels like more than just, not getting enough sleep.
Oh, absolutely. It's definitely more than that. Clinically, insomnia really boils down to being dissatisfied with your sleep, either how much you get or the quality of it. So that could mean finding it hard to fall asleep in the first place, or waking up a lot during the night, maybe waking up way too early and not being able to get back to sleep. And this is key. It happens even when you have the chance to get enough sleep. It can be a symptom of something else, sure, but it can also be its own distinct disorder.
Right. And it's not just a personal headache, is it? The research really hammers home that this is a big public health issue. It affects way more than just the person lying awake.
Spot on. The impact on society is actually pretty immense. We're talking serious costs. Billions lost in productivity every year because people are just too tired to function well, plus higher healthcare costs and, disturbingly, an increased risk of accidents like car crashes or workplace incidents. It's not just feeling groggy, it has real-world consequences.
It's kind of weird, though, isn't it?
Yeah.
The research shows it's super common, really impactful, but still widely underdiagnosed. We just accept it. And lots of people, maybe you listening right now, end up, scrolling YouTube late at night for relaxing sounds or sleep meditations, but without knowing if that stuff actually works based on science.
Exactly. And that ties into another big problem, access to effective treatment. The best non-drug treatment we have is called cognitive behavioral therapy for insomnia, CBTI. It's considered the gold standard.
Yeah.
But honestly, it can be really hard to get. There just aren't enough therapists trained in it, and a lot of people don't even know it exists or how well it works.
Okay, so we get the scale of it, the access issues.
Yeah.
But the big question is why? Why me? Why my partner? What does the latest science say is actually causing this sleeplessness? Is it just one thing?
Yeah, that's the million-dollar question. And the answer is, it's definitely not just one thing. It's complex. Researchers often talk about this 3Ps model. First, you have predisposing factors. Think of these as underlying vulnerabilities. Maybe it's genetic, maybe you're just naturally a more anxious person. Then, precipitating factors. These are the triggers. Stressful events, losing a job, getting sick, a big life change. That kicks off the initial insomnia. But then, and this is really important, you have perpetuating factors. These are the habits and anxieties that keep the insomnia going long after that first trigger is gone. Things you do or think that actually make it worse.
That makes sense, that tired but wired feeling. It's so common. Let's get into those factors. First up, the racing mind. Stress, anxiety. Your brain just won't switch off.
That's a huge one. Mental hyperarousal. It's like your body's stress response, the fight or flight system, gets stuck in the on position when it should be powering down for sleep. Studies actually show physical evidence of this, like higher levels of the stress hormone cortisol at night, and more activity in brain regions linked to alertness and emotion, like the prefrontal cortex. Basically, your brain fails to disengage. And then worrying about not sleeping adds fuel to the fire. It creates anxiety around bedtime itself, which, becomes a self-fulfilling prophecy.
And then there's our internal body clock, right? The circadian rhythm. Modern life seems designed to mess that up.
Oh, absolutely. Our natural 24-hour clock gets easily confused.
Yeah.
Irregular schedules are a big culprit. Staying up late, waking up at different times, shift work, it all throws it off. And a major factor, something we're all probably guilty of, is artificial light exposure, especially that blue light from phones, tablets, computers, TVs. That light actively tells your brain not to produce melatonin, the hormone that signals sleepiness, so it delays sleep onset, making it harder to feel tired when you actually want to be.
What about just bad habits, things we do every day without thinking, like coffee or naps?
Definitely critical. Those poor sleep habits add up. Caffeine too late in the day, say after 3 p.m. for many people, can interfere. Napping irregularly or too late can mess things up too. And a really common mistake is sleeping in way too late on weekends trying to catch up. That just confuses your clock even more for the week ahead. Also, the bedroom environment itself, if it's too hot, too bright, too noisy, that's obviously not helpful. But here's something interesting. Just spending lots of time awake in bed, maybe frustrated, can actually train your brain to associate your bed with being awake and stressed, not with sleep and relaxation.
Right. The bed becomes the enemy, almost. And some people just seem more prone to it, don't they? Maybe underlying health stuff.
That's true. There can be predisposing factors, genetics might play a role. We also know women tend to report insomnia more often than men, and very importantly, insomnia often travels with other health problems. Things like chronic pain, depression, anxiety disorders, they often go hand in hand. It becomes this difficult cycle where the insomnia makes the other condition worse, and the other condition makes the insomnia worse. So addressing those underlying issues, like maybe thyroid problems or sleep apnea, is absolutely vital. You can't just focus on the sleep alone.
And that leads to this frustrating loop, this insomnia cycle you mentioned, where trying to fix it actually makes it worse.
Exactly. It's how short-term, acute insomnia often morphs into the chronic kind. You have a few bad nights, maybe due to stress, then you start doing things to compensate. Drinking extra coffee during the day, taking long naps in the afternoon, going to bed super early, hoping to force sleep. Or maybe you lie there watching the clock, getting more and more anxious. All these reactions, while understandable, actually backfire. They increase the pressure to perform "I must sleep now," and they strengthen that association between bed and wakefulness. It really highlights that insomnia has both psychological and physiological roots. You need to tackle both the mind stuff and the body stuff to break free.
So, okay, putting it all together, untreated insomnia isn't just about feeling tired the next day. The research really paints a picture of quite serious, substantial consequences. It's more than just fatigue.
It really is. Connecting it to the bigger picture, the fallout is quite broad. Mentally, chronic insomnia significantly ramps up the risk for major depression, generalized anxiety disorder, even suicidal thoughts. This is changing how we think, you know. We used to see insomnia just as a symptom of depression, but now we understand it can also be a cause. Physically, it's linked to things like higher blood pressure, problems with blood sugar control, increasing type 2 diabetes risk, and generally a higher chance of heart problems down the line. Cognitively, you see impacts on memory, reaction time, decision-making, which obviously affects work performance and ups the risk of accidents. So yeah, leaving insomnia untreated is definitely not harmless. It's a genuine public health issue with ripple effects across your whole life.
Okay, that's the bad news. But the good news, the really encouraging part from all this research, is that there are effective strategies, real, practical, science-backed ways to improve sleep. Let's get into those, starting with the big one, CBTI.
Right, cognitive behavioral therapy for insomnia, CBTI. This is consistently shown to be the single most effective non-drug treatment for chronic insomnia. It's the gold standard. It has several core parts. There's stimulus control, basically, retraining your brain to associate bed with sleep. So if you're awake for, say, 20 minutes, you get out of bed. There's sleep restriction. Sounds weird, but you actually limit your time in bed initially to consolidate sleep, make it more efficient. Then cognitive restructuring, that's about identifying and changing those negative thoughts and worries about sleep. And usually some relaxation training. And the results are solid. Clinical trials show it reliably cuts down the time it takes to fall asleep, often by 20-30 minutes, increases total sleep time, and makes sleep feel more restful. And a huge plus, the benefits tend to last long term, up to 2 years later, which isn't always the case with sleeping pills, which can also have side effects and dependency issues. Now, the downside we mentioned is access. Finding trained therapists. It's tough. But the good news is digital CBTI programs like apps or online courses are emerging, and research shows they can be quite effective too, especially for younger people. Makes it much more scalable.
That's really promising. What about other approaches? Mindfulness? Meditation? Those seem to be getting a lot of attention for sleep lately. Is there science behind that too?
Yes, there is. Mindfulness-based approaches like mindfulness-based stress reduction, MBSR, or specific mindfulness-based therapy for insomnia, MBTI, are showing real promise. Studies suggest they work by reducing that pre-sleep arousal, both the racing mind and the physical tension. They help improve people's subjective experience of sleep quality. Randomized controlled trials are finding significant drops in insomnia severity scores with these methods. The idea is that mindfulness helps you detach from those racing thoughts, that monkey mind, and it calms the body's stress response, easing the transition into sleep. It seems to help regulate brain networks involved in rumination and stress, like the default mode network and the amygdala. It also seems particularly helpful for people who have anxiety or depression alongside their insomnia. And studies, like one from 2023, show these benefits can stick around for months after the program ends.
Okay, and for people who find total silence maddening when they can't sleep, what about sound, music therapy, white noise?
That's another really interesting area with good evidence. Music can be a powerful sleep aid. A big review in 2023 concluded music can definitely reduce insomnia severity and improve sleep quality. And get this, the effects were sometimes comparable to certain sleep medications, but obviously without the side effects. One mechanism is called entrainment. Slow, calming music, maybe around 60 to 80 beats per minute, can actually help your body's own rhythms, heart rate. Breathing slow down and sync up with the music. It kind of gently nudges your body towards relaxation. What's cool is that the specific type of music seems less important than whether you find it calming, so you can make your own relaxing playlist. Often, instrumental music is better, fewer distractions from lyrics. Just practical tips. Keep the volume low, make sure your phone screen is off if you're using an app, maybe use a sleep timer. And yeah, things like white noise or nature sounds can also help by masking other noises that might wake you up.
Makes sense. And finally, we can't ignore the basics, right? Exercise, lifestyle stuff. How much does that daytime activity really matter for nighttime sleep?
It matters a lot. Regular physical activity, both cardio like jogging or swimming, and resistance training like weights is strongly linked to better sleep. Exercise helps regulate stress hormones, boosts mood, and can lead to deeper, more restorative sleep cycles. A big study just this year, 2024, found people exercising at least twice a week for an hour or more were much less likely to have insomnia. Generally, it's best to exercise earlier in the day, not too close to bedtime, but consistency is probably the most important thing. Even gentle evening yoga can be helpful for winding down. And yes, reinforcing those fundamentals is crucial. Cutting back caffeine, especially afternoon, evening. Keeping a consistent sleep schedule, bedtimes and wake times, yes, even on weekends. And making sure your bedroom is truly optimized for sleep. Cool, dark, quiet, and ideally, tech-free. These are often the very first things a sleep specialist will recommend. So, this raises the question, how do these stack up? Where should someone start? CBTI is still considered the most powerful tool specifically for chronic insomnia, given the strong evidence. But mindfulness, music, lifestyle changes, these are really valuable, accessible, low-risk options. They align with how people often try to help themselves anyway. The research really points towards a kind of stepped care approach. Start with the lifestyle foundations, maybe try mindfulness or music if that appeals. If insomnia persists, then seek out CBTI. Medications are generally reserved for more severe cases or when other things haven't worked, always weighing the benefits against the risks like side effects and dependence.
Right. It really sounds like because insomnia has so many potential causes, the solutions need to be multi-pronged too, not just one magic bullet.
Exactly. That's the core message from the research. Insomnia is multifactorial, so integrative solutions usually work best. Combining elements, maybe CBTI techniques with regular mindfulness practice, or using calming music, that often gives the most effective results. And it helps people rely less on sleeping pills. Thinking about clinical practice, what this means is doctors and therapists should really take a holistic view. Yes, recommend CBTI, but also be open to discussing and guiding patients on things like meditation or music if they're interested, educating patients about sleep hygiene, the role of exercise, the risks of medication that's vital, and better collaboration between sleep specialists, mental health pros, and primary care doctors is definitely needed.
And zooming out even further, what about public health? How do we make a dent in those big numbers you mentioned earlier?
Yeah, on a public health level, insomnia needs to be taken seriously as a chronic condition. We need more awareness campaigns, more preventative strategies. Think about educational programs maybe in schools, in workplaces promoting good sleep habits, using media to get the message out, integrating sleep health into routine checkups. And critically, policy changes are needed to boost funding for CBTI access, including those digital versions, and pushing for better insurance coverage for these proven behavioral treatments.
So much progress, but still more to learn. What are the big unanswered questions? Where is sleep science heading next?
Well, there are definitely research gaps. For things like mindfulness and music, we need larger studies with more diverse groups of people to really nail down their effectiveness and standardize the best ways to use them. There's also not much research looking at cultural differences, how insomnia is experienced and treated across different cultures. That's important. With digital treatments, we need more long-term data on whether people stick with them and if they remain effective over time. And a big frontier is formally testing these integrative models, combining CBTI, mindfulness, music, exercise, to see if they truly offer synergistic benefits and figure out the optimal combinations for different people.
Okay, so let's wrap this up. The main takeaway here feels like insomnia is incredibly frustrating, yes, but it's not just some vague thing that's all in your head.
Yeah.
There are real, understandable, science-backed reasons why you might be struggling to sleep. And, thankfully, there are real science-backed solutions too. So remember, by understanding these causes, by applying these strategies, good sleep habits, relaxation techniques like meditation or music, and not being afraid to seek professional help like CBTI, if you need it, you really can gain control and break that cycle. Just be patient with yourself. Progress might be gradual, but every little improvement counts.
Absolutely. And maybe the final thought to leave you with is this. Tackling your sleep problems isn't just about feeling less tired. It's actually a profound investment in your overall health, your mental clarity, your productivity, and ultimately, your quality of life. Better sleep really can lead to a better life.
Thank you so much for joining us on this deep dive.